Okay, let's unpack this deep dive. As pet owners, well, one of the absolute hardest things is facing a really serious illness with our furry companions.
Mm,
And today we're diving into a particularly tough subject, canine and feline tonsil squamous cell carcinoma. It's really aggressive cancer right there affecting the back of the throat.
yeah, definitely not an easy topic. And we've pulled together quite a bit of, detailed clinical information and guides to help us understand the stark realities of this disease.
Right. So our mission here is to go through these sources, pull out the absolute essential knowledge for you, our listener.
Exactly.
We want to give you a clear, well-informed picture of what tonsil SCC is, why it's such a serious threat, and frankly, what dealing with it actually looks like, sort of cutting through the complexity to get to the core insights.
Mm.
So diving right in, what exactly is this cancer at its root?
Well, at its simplest, tonsil squamous cell carcinoma, or SCC, it's a type of malignant tumor. It originates from those skin-like lining cells, the squamous epithelium of the tonsils. And those are located, right there in the back of the throat.
And is it something we see, like, equally in dogs and cats? Or is there a difference?
It's definitely more commonly diagnosed in dogs. The sources say it represents about 9% of all oral tumors in dogs.
Okay.
Now, in cats, oral SCC itself is unfortunately common, but the tonsil specifically is a less frequent location compared to, say, under the tongue or on the gums. But it absolutely still happens in cats.
Got it. Let's talk about who might be more susceptible. Do we see this more often in, certain types of pets?
Well, the sources point to a median age range of about 10 to 12 years for both dogs and cats when they're diagnosed.
Okay, so older pets generally.
Generally, yes.
Yeah.
But it's really important to know it can happen across a much wider age range. We're talking from quite young, maybe 2.5 years old, all the way up to 17. So quite a span.
And what about breed or sex? I noticed the sources they weren't in complete agreement there.
That's right, yeah. One source suggests it might be more common in older, intact male dogs, and even mentions specific breeds like terriers, schnauzers, Rhodesian Ridgebacks, greyhounds, potentially at higher risk.
Interesting.
But then another source states there's no known specific breed or sex predilection overall. So I think this tells us the full picture of, who's predisposed is still being actively researched. It's not quite pinned down yet.
That difference is interesting, but here's a finding from the sources that really, really caught my eye. The environment might play a pretty significant role.
It's certainly seen so. There's one notable statistic that this cancer is reported as being 10 times more common in dogs living in urban environments compared to rural ones.
10 times. Wow, that's a striking difference. What could possibly explain that?
Well, the sources hypothesize it could relate to increased exposure to environmental carcinogens in those urban settings.
Huh.
And for cats, specifically, exposure to tobacco smoke is often suspected as a potential contributor. It definitely raises questions about external factors impacting this internal disease.
Absolutely. Okay, let's unpack the biology of this tumor, because this seems to be where we understand why it's just so concerning. What makes it such a problem once it actually starts?
Yeah, the defining characteristic really of tonsil SCC is its extreme local aggressiveness.
Aggressiveness.
It doesn't behave like a tidy little lump. It rapidly invades and infiltrates nearby vital tissues like the pharynx and larynx, parts of the throat and voice box, and the surrounding muscles too.
So it's like growing tendrils into everything nearby.
You could think of it like that. Imagine something growing and quickly wrapping itself around critical structures right there.
Yeah.
Very invasive.
Okay, so it's tearing through the tissues right where it starts. But the real terror, I guess, based on these sources, is its tendency to spread, to go far and wide.
Absolutely. That's the key. Its high metastatic potential is what truly sets tonsil SCC apart from many other types of squamous cell carcinoma, like maybe one you'd find on the skin.
Right.
This isn't just a local issue for very long, unfortunately.
So where does it typically like to spread first?
Well, the most common first stop is the regional lymph nodes. Those are the little graining filter stations in the neck area, specifically the mandibular and the retropharyngeal nodes.
Okay.
And the sources indicate metastasis to these nodes is present in a staggering percentage of cases at the time of diagnosis.
At diagnosis, already spread.
Yes. We're talking over 70%, potentially even exceeding 80% in dogs,
Yeah.
and over 31% in cats, right when they're first found.
Wow. So for most dogs then, by the time it's actually identified, it's already moved into the lymph nodes.
That is the grim reality the sources really highlight, yeah. And It doesn't necessarily stop there.
Right.
Distant spread, most commonly to the lungs, is also frequent and often happens relatively early in the process.
The lungs, okay.
Yeah, lung metastases are reported in about 40 to 60% of dogs based on the sensitive imaging like CT scans. Other sites like bone or other organs can be affected too, though maybe less commonly seen right at presentation.
So because it spreads so readily, especially to those lymph nodes so early on, is it effectively considered a systemic disease, like right from the outset in many cases?
Yes, I think that's a crucial takeaway. The sources indicate that somewhere between 70% to 90% of cases will eventually metastasize, regardless of how well the original tumor itself is controlled locally.
Regardless of local control.
Exactly.
Okay.
This really high metastatic rate is the fundamental reason why treating it effectively is so incredibly challenging and why it's often approached as a systemic problem right away.
Given how aggressive and, well, sneaky it can be, what does this actually look like to an owner? And how do vets typically uncover it? Because I imagine those early signs must be really easy to miss.
You're absolutely right, and that's a huge part of the difficulty. It often leads to delayed diagnosis and consequently a poorer prognosis. The initial clinical signs are often quite subtle, very nonspecific.
So what kind of subtle things might owners notice, maybe looking back?
Well, often it revolves around the mouth and throat area just because of the tumor's location. Owners might notice signs of oral pain, maybe difficulty eating or swallowing. Sometimes we call that dysphagia.
Dysphagia, right.
Yeah, maybe a reluctance to chew hard food or dropping food or just a general lack of appetite, maybe leading to some weight loss over time.
Are there other signs that might point more directly to the throat itself?
Yes, sometimes a foul mouth odor, halitosis we call it, can be present. Excessive drooling is pretty common, and sometimes that drool might even be bloody. Cats might cough or gag, especially seems like after eating or drinking if the tumor's irritating the area. Occasionally, there might even be a change in their bark or meow or just, generalized lethargy and depression. Seems off.
And when a pet actually goes to the vet with some of these vague signs, what might the vet find during an examination?
Well, a really thorough oral exam and palpation that's feeling the throat and mouth area usually needs sedation or light anesthesia.
Right, because it's sensitive back there.
Exactly. It's sensitive and just hard to examine fully when they're awake. The vet might actually see an abnormally enlarged tonsil. But crucially, sometimes enlarged lymph nodes in the neck area, those mandibular and retropharyngeal nodes we mentioned, they're often the very first thing a vet can physically feel, sometimes even before the tonsil tumor itself is obvious. These nodes might feel firm, maybe not even painful to the touch.
Interesting.
You might also see some swelling in the throat or neck area, and the pet might show pain when the vet tries to gently open their mouth wide.
So if the vet suspects something like this, based on those findings, how do they get a definitive answer? What confirms it?
Yeah, the gold standard, the absolute best way to confirm the diagnosis, is getting a piece of the actual tumor tissue, then having a specialist look at it under a microscope that's called histopathology from an incisional biopsy.
So just sticking a needle in isn't enough?
Usually not for this. Taking just a sample of cells with a needle, cytology, is often not sufficient for this specific cancer. It can be hard to differentiate it from other things like inflammation or less aggressive tumors. You really need the tissue structure to be sure.
Okay, biopsy is key. And then imaging, I assume, is a huge part of figuring out the extent of the problem, how far it's gone.
Absolutely. Imaging is essential for what we call staging, basically figuring out how far the cancer has spread beyond that original tonsil.
Right.
A CT scan of the head and neck is considered the gold standard for this local assessment. It gives really detailed pictures showing exactly how much the tumor has invaded nearby tissues and, importantly, if those regional lymph nodes look involved.
And that helps with planning treatment?
Critically important for planning any treatment, yeah. Whether it's surgery or radiation, you need that map.
And what about checking for spread further away, like to the lungs?
That's equally essential. Thoracic imaging. So chest x-rays are often done first, but a CT scan of the chest is much more sensitive.
Much more sensitive.
Yes, highly recommended because it can pick up tiny metastases that simple x-rays might miss. Remember those statistics we talked about?
Yeah, the difference was big.
Exactly. Lung mets might be found in maybe 5–20% of dogs on x-rays at presentation, but that number jumps significantly up to 40–60% when you use a CT scan.
Wow.
Getting that CT picture gives a much more accurate assessment of whether there's distant spread already there.
Yeah, that difference in detection really highlights why that advanced imaging is so important for getting the full picture.
It really does. Sometimes an abdominal ultrasound might be part of a full workup too, though spread to abdominal organs is generally less common at diagnosis. And because those regional lymph nodes are such a high-risk site for spread, taking a sample aspiration or even biopsy of the mandibular and retropharyngeal nodes is pretty much always recommended, even if they feel normal to the touch.
Even if they feel normal.
Yes, because tiny cancer cells, what we call micrometastasis, might already be hiding there.
Got it. So it sounds like a very thorough workup is absolutely key. But are there other things this could be mistaken for initially before the biopsy?
Oh, yes, definitely. The signs can overlap with simpler things like, just tonsillitis or other types of tumors like lymphoma or melanoma or even a throat abscess.
Right.
And that's exactly why getting that tissue biopsy is non-negotiable for a clear diagnosis. Interestingly, basic blood work like a CBC and biochemical panel is usually normal with this particular cancer. Doesn't often show up there.
Okay. So we understand what it is, how aggressively it invades and spreads, the often subtle signs, and the detailed diagnostic process. Now comes, well, the most challenging part. What can actually be done about it, and what is the typical outcome?
Yeah, this is tough. Because of its aggressive local nature and that really high metastatic rate, treating tonsil SCC is almost always a multimodal battle.
Multimodal, meaning multiple types of treatment.
Exactly. A single therapy, like just surgery or just chemo, rarely suffices. A combination is almost always recommended to try and tackle it from different angles.
Okay, let's start with surgery then. Can they actually remove the tumor?
Well, surgery involves removing the affected tonsil, sometimes even both tonsils, and often those draining lymph nodes in the neck, a procedure called a mandibular lymphadenectomy.
Okay.
The goal, of course, is to remove the entire tumor with wide, clean margins of healthy tissue around it. However,
There's a
big however. Due to its location deep in the throat and its really invasive nature, achieving those truly clean margins is extremely difficult, very challenging.
And if they can't get clean margins, what happens then?
Well, local recurrence, the tumor growing back right there after surgery alone, is unfortunately very, very high. Some sources report it near 100%.
Wow, near 100%.
Yeah. So while surgery might be performed, sometimes quite aggressively, maybe to help with breathing or swallowing issues caused by the tumor bulk,
Right.
it's almost always followed by other therapies to try and deal with any microscopic cells inevitably left behind.
Okay.
And crucially, because of the pain and swelling after what can be extensive surgery back there, feeding tubes are often essential, both for post-operative recovery and sometimes longer-term nutritional support.
Right, that makes sense. What about radiation therapy? Where does that fit in?
Radiation therapy can be moderately effective for achieving local control of the tumor right in that area.
Okay.
It's often used after surgery if the margins weren't clean, what we call adjuvant therapy. Or it might be used as the primary treatment if surgery just isn't a feasible option for that particular tumor.
Or for just comfort.
Yes, exactly. It can also be used palliatively, meaning not aiming for a cure, but to relieve painful symptoms like difficulty swallowing and improve quality of life.
Does it have side effects?
Like any treatment, yes. Primarily inflammation in the mouth and throat initially, sort of like a severe sunburn inside. There could be potential late effects too.
Okay. And chemotherapy, you mentioned this often spreads. Is chemo used to fight that?
Yes, absolutely. And it's highly recommended because of that significant risk of metastasis we keep coming back to.
Right, the systemic part.
Exactly. The goal with chemotherapy is to target any cancer cells that might have already traveled away from the original tumor through the bloodstream or lymphatics. It acts as a systemic treatment.
What kinds of drugs are used?
Vets use various drugs, often platinum agents like carboplatin or sometimes cisplatin, though cisplatin is generally not safe for cats. Very important note there.
Okay, good distinction.
And sometimes drugs like doxorubicin. Often, chemotherapy is combined with anti-inflammatory drugs, NSAIDs.
NSAIDs, you mean like piroxicam or meloxicam?
Exactly those, yes.
Yeah.
Drugs like piroxicam or meloxicam are commonly used. And while they definitely help manage the pain and inflammation associated with the tumor, they also seem to have some potential anti-cancer effects themselves in certain SCCs by targeting specific cellular pathways, like COX2.
Oh, interesting. So they do double duty.
Potentially, yeah.
Yeah.
The sources mentioned one study where piroxicam used alone actually showed a partial response or at least stabilized the disease in a few tonsil SCC cases. So it's an interesting component often used alongside the other main treatments.
Are there any other treatment options mentioned in the sources?
Yes, some sources mention things like metronomic chemotherapy. That's a different approach using low doses of chemo drugs more continuously, like daily.
Okay.
And sometimes target therapies called TKIs, tyrosine kinase inhibitors, like a drug called tosiranib, brand name Palladia. Electrochemotherapy, which uses electrical pulses to help chemotherapy get into tumor cells locally, is also sometimes listed as an option in specific situations.
Given how challenging this cancer clearly is to treat definitively, is palliative care focusing on comfort a major focus?
It is absolutely crucial. I'd say perhaps the most vital aspect of care, especially when the disease is advanced or metastasis is already present.
Right.
When a cure isn't realistic, the absolute focus has to shift to maintaining comfort and preserving the best possible quality of life for as long as possible.
So what does that involve?
Aggressive pain management is completely non-negotiable. Using a combination of different types of pain medications like those NSAIDs, opioids, maybe gabapentin, amantadine, tailored specifically to the pet's needs and adjusted frequently.
Okay.
Antibiotics might be needed for secondary infections if the tumor gets ulcerated, and sometimes appetite stimulants can help. But really, pain control is paramount.
And those feeding tubes you mentioned earlier, how critical are they in palliative care?
Often essential. Nutritional support via a feeding tube, like an esophagostomy tube placed in the neck or a gastrostomy tube going into the stomach, is frequently necessary.
Because eating just becomes too painful.
Exactly. Severe oral pain and the physical difficulty of swallowing can just make eating impossible or extremely stressful for the pet. Providing nutrition this way is vital for maintaining their strength, their energy levels, and overall quality of life, sometimes for weeks or months, especially in cats.
All right, this brings us inevitably to the prognosis. What is the typical outcome, the hard reality for a pet diagnosed with tonsil SCC?
Yeah, this is the hardest part of the conversation, always. The prognosis is generally considered poor to very poor for both dogs and cats.
Poor to very poor.
Yes. And this is a direct consequence of the two main factors we've discussed. The tumor's aggressive local invasion, making it hard to remove completely, and, most significantly, its incredibly high rate of early metastasis.
Can you give us a sense of the actual survival times based on the sources? What do the numbers look like?
Yeah, the median survival time, that's the point where half the pets have passed away and half are still alive, even with aggressive multimodal treatment combining therapies, typically ranges from about 4 to 8 months for dogs.
4 to 8 months with aggressive treatment.
Yes. If it's left untreated, the median survival is sadly only around 2 months.
Okay.
Surgery alone, because of that high recurrence rate, often only achieves maybe 2 to 4 months median survival. Combining surgery with either radiation or chemo might extend that slightly, perhaps into the 3 to 4 month range on average. Palliative radiation or chemo, aimed at comfort, can offer symptom relief and might result in median survivals anywhere between 2 and 9 months, really depending on how well the tumor responds.
What about the most intensive approach, combining everything, surgery, radiation, and chemo?
That combination does seem to offer the longest median survival times reported among the standard treatment protocols. The sources suggest potentially ranging from 9 to 12 months in some studies for dogs.
Okay, so maybe up to a year median with everything thrown at it. Is there anything at all that significantly improves that outlook? Any positive prognostic factor?
Yes, there is one, and it's arguably the most important positive factor mentioned. It's the absence of metastasis, particularly to those regional lymph nodes at the time of diagnosis.
Ah, so if it hasn't spread yet.
Exactly. If the cancer is caught before it is spread detectably to the lymph nodes, that makes a significant difference. Some studies actually show median survival times potentially exceeding 600 days, so well over a year and a half, for dogs diagnosed without detectable lymph node spread.
Wow, that's a huge difference.
It's a massive difference, and it truly underscores how incredibly crucial early detection would be if we could achieve it. Ideally, finding it before the cancer has left the tonsil.
Are there specific factors that make the outlook even worse than average?
Yes. For dogs, the sources note that being anorexic, so not eating, or being very lethargic when they are first examined, are considered negative prognostic indicators. It suggests more advanced disease usually.
And what about for cats? Is it any different?
Unfortunately for cats, the prognosis is similarly very poor. Typical median survival times are quite short, often only 2 to 5 months, even with attempts at treatment. Like dogs, their outcome is really limited by that aggressive local invasion and the high tendency for spread.
Okay. So for families who are navigating this incredibly difficult diagnosis, what does the ongoing care and monitoring look like after that initial treatment phase? What's the day-to-day, week-to-week?
It definitely requires very close monitoring and a significant commitment from the owner.
Yeah.
They're constantly watching for any side effects from the treatments they've received, whether it was radiation or chemo.
And managing pain continues to be key.
Absolutely. Aggressive pain management is ongoing. It needs to be regularly assessed and adjusted because pain often remains a significant challenge throughout the course of the disease.
And keeping their nutrition up.
Yes, absolutely vital. Monitoring their weight, their food intake is continuous. And if a feeding tube is in place, managing that tube care becomes a daily task for the owner.
What about vet checkups?
Follow-up appointments are usually quite frequent, often every 1 to 3 months. Vets will perform thorough re-examinations, checking the mouth and throat area carefully, and very carefully palpating those regional lymph nodes again.
And repeat imaging to check for spread or recurrence.
Yes, periodic imaging is generally necessary to monitor for disease progression. This usually includes regular thoracic X-rays or, ideally, CT scans to check for any new lung metastasis, and potentially follow-up CT scans of the head and neck to look for local recurrence of the tumor back in the throat area.
This sounds like a very demanding and emotionally draining journey for pet owners. What are the absolute key messages that vets need to convey right from the very beginning when giving this diagnosis?
Yeah, I think transparency is absolutely essential. Owners need to understand right up front the highly aggressive nature of tonsil SCC and its very high likelihood of spreading.
No sugarcoating it.
No. Explaining the inherent difficulty in treating it effectively because of its invasive growth and its difficult location is also critical for managing expectations realistically.
And being realistic about the future, the prognosis.
Yes, being direct but also compassionate about the generally poor to very poor prognosis is necessary, emphasizing that for many pets, the primary focus really shifts towards excellent palliative care and maximizing quality of life, rather than solely pursuing a cure at all costs. That shifting goals is paramount.
And hammering home the importance of pain control.
Absolutely. Stressing that aggressive pain management is foundational. It's not an optional extra. It's absolutely central to their pet's well-being and comfort.
And preparing them for the practicalities, like the possibility of needing a feeding tube.
That's a conversation that really needs to happen early on. Helping owners understand that a feeding tube isn't a failure, but often crucial supportive care for managing nutrition and also the pain associated with eating is vital. Explaining the need for that multimodal approach, using multiple therapies, but also acknowledging honestly that even these combined treatments have significant limitations is important too. And of course, being upfront about the potentially significant financial commitment involved, the extensive diagnostics, the often complex treatments, the ongoing supportive care, it all adds up.
Right. And finally, just acknowledging how challenging it is for everyone, including the owner, that this cancer is so hard to catch early because those first signs are just so easily overlooked or mistaken for something minor.
Yes, exactly. Managing those expectations, providing immense support alongside the medical plan. That's absolutely key.
Well, this has certainly been a deep dive into a really, really difficult diagnosis. It's just crystal clear that tonsil SCC is defined by its relentless local invasion, its extremely high metastatic potential, and the profound challenge of catching it early because of those subtle initial signs.
It is. And while the prognosis is undeniably tough, that focus on aggressive, proactive pain management and truly prioritizing the pet's comfort and quality of life becomes the absolute guiding principle for compassionate care.
Thinking about everything we've covered here, especially that potential link to environmental factors, maybe something specific in urban settings, and then how vastly different the prognosis is if the cancer hasn't spread to the lymph nodes by the time it's diagnosed. It really makes you think about the path forward, doesn't it?
It really does. It raises a pretty fundamental question, I think. Given these insights from the sources, where should future research and maybe our awareness efforts truly focus? Should the priority be on trying to identify and potentially mitigate those environmental causes that might be contributing? Or should it be on finding truly groundbreaking ways to detect this subtle, aggressive disease much, much earlier, ideally, before it's ever had a chance to metastasize and become a systemic problem?
That's a really interesting question, something for you, our listener, to definitely ponder.